In poor, remote communities in the tropics, onchocerciasis, or river blindness, infects nearly 18 million people, 99% of them in Africa. Victims are infected by tiny parasitic worms, transmitted by the bite of a small black fly that breeds in fast-flowing rivers.
I wouldn't be surprised if you got 20 to 25 bites an hour at certain times a day here. That's the kind of biting rate that will easily sustain river blindness.
Spreading through the body, the worms can cause total blindness, and more commonly, a severe skin rash.
And you get a tremendous amount of itching. It's difficult to describe this level of itching because it's really reputedly has driven people to commit suicide.
In Uganda, the government has now made a major commitment to fight this disease, working closely with the Carter Center based in Atlanta.
Throughout Africa, the attempt really now is to control the disease, to prevent blindness, to prevent skin disease. In Uganda, the idea is to completely get rid of the parasite and therefore, for once and for all, be through with the problem.
To achieve that, Ugandan health authorities have adopted a two-part strategy. The first, a mass treatment program with Mectizan.
Mectizan is a medicine that is given free of charge by Merck & Company, billions of doses having been provided. This medicine is so safe. It doesn't need refrigeration. It doesn't need needles. It doesn't need highly trained people.
Mectizan kills immature worms in the body, not only relieving itching, but also improving vision and preventing blindness. The second part of the strategy is vector control, attacking the black flies that transmit the disease.
We're here on the Katomi River, and we are measuring flow rates to be able to determine the best way to dose an environmentally friendly, what we call larvicide, called abate, to kill the aquatic stages, the water stages of the black fly, which live on freshwater crabs.
More than 90% of the crabs in this river were once infected with developing stages of black flies, but after a year of monthly treatments like this, the crabs are clean.
A lot of crabs, but crabs that are clean of the black fly larvae and pupae, which indicate that the abate is doing what it's supposed to do. It's not hurting the crabs, but it is stopping the black fly. Take Mectizan. I think the outlook for river blindness right now is very bright as we really begin to think about the opportunities we have to completely eliminate the parasite.
By eliminating black flies wherever they're found and providing Mectizan treatments to populations at risk, Uganda is making real progress against a tormenting disease.